Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes. With your host, Dr. Rhiann Windsor. Dr. Windsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she spent her career helping clinicians and care teams optimize patient outcomes. Health centers sit at the front lines of care for thousands of communities, but the policy, funding, and workforce environment around them is changing fast. In part one of this three-part series, we're joined by Jessica Yanow, President and CEO of the Arizona Alliance for Community Health Centers. She shares insights on the evolving policy landscape, financial pressures facing health centers, and what leaders should be watching as they plan for the future. From Medicaid shifts to workforce shortages, this conversation explores the realities shaping primary care today and what comes next. The policy environment may be shifting, but the mission of community health centers remains the same: serving patients and strengthening communities.
Today we are thrilled to welcome back a familiar and respected guest, Jessica Yanow, President and CEO of the Arizona Alliance for Community Health Centers. In our last conversation, we explored some urgent issues facing health centers today, like Medicaid threats, innovation in care delivery, and the growing complexity of the healthcare landscape. So this time, we're diving a little bit deeper. Jessica joins us to help unpack the evolving policy environment, the future of the FQHC workforce, and the rise of digital tools and AI, lessons learned from Medicaid unwinding, financial sustainability, and what the next decade of primary care might look like. We have a lot to talk about, Jessica. Thank you for being back here again with us.
Thank you for having me.
We always learn so much from you, and we're excited to continue the conversation. And as a matter of fact, your episodes have received the most views out of all of our episodes. So we're excited to get started. Do you want to just say a little bit about yourself to remind our listeners if they didn't hear your previous episode?
Sure, I'm happy to. Jessica Yanow. I am the President and CEO of the Arizona Alliance for Community Health Centers. We are the primary care association for the state. So we are a membership organization of all the community health centers in the state. We provide training and technical assistance to health centers. We also provide programmatic support, and we do advocacy on behalf of health centers. And that advocacy can be with state agencies. It can be with elected officials at both federal and state levels, but basically we exist to make sure that health centers have the resources and supports they need to serve their communities. Our members in Arizona in 2024 served 870,000 Arizonans. So 1 in 9 Arizonans is a patient at a community health center. 1 in 5 Medicaid beneficiaries in Arizona are patients at community health centers. And our health centers employ over 10,000 FTEs. So we are really economic drivers in the state as well. Often in many communities in the state, especially in our rural areas, the health center might be the healthcare provider in the community. And we are really proud of the health centers being those trusted partners in the community.
Thank you for all the work you're doing. So as we're looking ahead to 2026, what policy or regulatory changes should health centers in Arizona be preparing for now?
That is a great question, Rhiannon. So in 2025, we saw a lot of changes in a very short period of time. We saw shifts in vaccine policy. We saw new pressures on the core mission of community health centers. And there has continued to be real uncertainty around funding and reimbursement as well. A lot of it required us to adapt really rapidly. And as we look towards 2026, I think we have to be prepared to continue that approach. There is likely continued volatility in the policy environment. We have to plan for regulatory updates that might affect quality reporting, so our UDS measures, and that is changing. There's an RFI out right now, or maybe not an RFI, but a request for feedback on changing UDS measures. Scope of practice, telehealth authority, and shifting federal posture to programs like 340B. We were very lucky that 340B rebate pilot that had been proposed has been put on hold by the courts, but we should expect more changes in the 340B arena, and that adds instability for health centers. So the folks that are going to do their best through this rapidly changing time are the folks that remain flexible, and that is what we need to continue to do.
That list has my head spinning. I don't know if anybody else listening feels that way. How do health centers keep up with all of these changes?
That is a great question. I feel like we send out more communication. So I'm in I just finished 4 years in this role, and I would say over the past year, the amount of communication, we always want to be strong communicators, make sure health centers have good, relevant, timely information, but it's at a whole other level right now. We've added additional weekly calls for our board of directors to update them on the policy and regulatory environment as well. And so it really is about making sure you're reading your email, making sure you're attending meetings and staying connected to all those issues, because I think it's very easy to miss something, and the changes are so rapid and there's so many of them. And it's also about prioritizing, right? We will share as much as possible. We will also try to prioritize how those communications go out, and we know that health center leaders have to do that as well. What are the things they need to focus on today with their teams? What are the things that are hovering there somewhere that they can put off a little bit longer? When do they need to be aware and make rapid decisions? I think those are all things that we're constantly still figuring out.
The inundation of information that's coming at you guys and coming out at the health centers as well.
Well, and I think, back to priorities, pretty early on when we realized that there were going to be so many changes in direction, so many policy changes, we really sat down and thought about what are the things that we need to protect for health centers, and that has been our North Star. So there are other things that impact health centers most certainly, and we do address those as well, but we remain focused, and I think that is the thing that's helping health center leaders too, is prioritizing. These are the things that are going to keep us functioning, and these are the things that we really care about, but maybe we don't spend as much time on right now.
Mm-hmm. Especially with limited resources. Yeah. I'm sure that's really helpful for them. So I have a question about HRSA.
Yes.
Health Resources and Services Administration. What are there changes in those policies? And if there are there any concerns or additional supports for FQHCs?
Yes. So there definitely are changes, and I think it's really important for health centers to pay attention to those. So, for example, the HHS grants policy has changed and been updated over the last several months. Health centers have received notices of awards with new language in them. The operational site visit guidance has changed for health centers when they're having their operational site visit from HRSA. And so what I would say is the most important thing is really paying attention to all of those changes and making sure that you're adapting your operations to respond to those changes. I think one of the things that we've heard a number of times and has been shared by the current administration is there is more risk to grants if for some reason they are not in alignment with the administration. So it's really important to be looking at what are HRSA's priorities, if you have SAMHSA grants, what are SAMHSA's priorities? It's not a fail-safe, right? But paying attention and making sure that you're coloring within those lines is going to go a long way to keep you compliant with the requirements of the funding. But yes, I would say it has been changing, and I would expect that it's still going to change, and there might be more guidance. I think there are other opportunities. So I mentioned Uniform Data System, UDS reporting before. There's an opportunity there because the desire has been to streamline those reporting requirements. And so where you can provide feedback about what that looks like, and if there's things in UDS that you are having difficulty with reporting, don't make sense to you, this is an opportunity to share that with the Health Resources and Services Administration and for the benefit of health centers. Where that lands ultimately, we don't know because they have to take all the public feedback, but there are opportunities there as well.
So I'm guessing there's some sort of database or somewhere like health centers can go to see what are the latest updates to these grants and those sorts of things?
Not necessarily. I think that's one of the other challenges, right? Yes, HRSA does have a website, and their website does have updates around what some of the latest challenges are. If you get your notice of award, an updated notice of award, you're going to get an email. If you want to understand what it means, probably the best thing to do is to reach out to us at the Alliance, or if you're in another state, to your primary care association. We are tracking all of these things and can provide additional guidance. My team is very knowledgeable about operational site visits, for example, so becoming familiar with the new requirements for operational site visits to make sure our health centers understand those. A primary care association is a great resource for that. Yes, updates will be on HRSA's website, but there is no, if they're different kinds of updates, there's no one place to get them all. So your primary care association is probably your best bet.
Okay, that's great to know. So where do you see the biggest opportunities or risks for FQHCs over the next year and a half, 2 years?
So I'll talk about opportunities first. I think nationally, one of the most promising opportunities in front of us is the Rural Health Transformation Fund. So we know that Arizona was awarded $167 million a year for 5 years. They're currently in budget negotiations with CMS right now, so it's going to take a while for those funds to then come into the state. And those funds are going to be focused on a variety of areas to address healthcare in rural parts of the state. And so some of that can be workforce, some of it can be technology, but that's going to be an opportunity for health centers, a way to build infrastructure, to strengthen partnerships, and to reimagine care delivery for the long term. I think something else that will be an opportunity for us, and I don't know what it's going to look like coming down from the federal level, is health centers really are the cornerstone of the movement to make America healthy. What the opportunities are for us through that, I think we really need to be paying attention to and jumping on board with. Unfortunately, we don't know what that looks like yet. And I think the risks are very real at the same time, just in the environment in general. So things that health centers are already seeing: rising costs, regulatory uncertainty that we just talked about, the challenge of balancing innovation with stability. How do you move forward, and what resources do you have to do that when we're in an environment where some of the resources are shrinking? Like I said before, the shifts in the past year have been profound, and they will continue to be. And so it means constantly rethinking your programs, rethinking your services, rethinking your locations, which is hard. It can mean difficult conversations across health centers to maintain services for communities, and we are seeing decisions like that having to be made. But again, because we really are the underpinning for making America healthy, we have the opportunity to demonstrate our effectiveness. So I always want to think about what are the opportunities. It doesn't mean the challenges don't exist and that they're not great. But I think there's things we don't know yet what's coming down the pike, and some of them could be very positive for health centers.
Yes, so awareness, I'm hearing, is definitely a key factor there. Can you speak a little bit to the health center model? Is that going to place health centers in financial difficulty? Number of uninsured are growing, of course, and what that kind of looks like as far as sustainability and payer mix?
Sure. Payer mix is critically important to financial sustainability for health centers. We've always been very proud to be able to serve everybody regardless of their ability to pay. I can't speak to other states. I can talk about Arizona. In Arizona, we saw an increase in uninsured patients across all health centers. In 2024, we saw a decrease in Medicaid, and we saw an increase in Medicare, and that holds true nationally, an increase in Medicare, which is great. We are finding that patients that were already patients at health centers, once they have Medicare and have more choices, still want to be patients at health centers. So that's a really positive thing. We have seen an increase in third-party insurance as well. One of the challenges is we see the increase in uncompensated care, and the base funding that supports health centers does not increase, but inflation still happens, and a decrease in Medicaid. It can certainly create risks for health centers. And so it's important for folks to be paying close attention to what their payer mix looks like, taking action early if they see something concerning that's not matching how they budgeted for the year. I think that we are all in this movement really committed to this model, making sure that everybody has access to care in their community. But what it looks like long term, as payer mix might continue to shift and funding may not change very much, I don't know.
This might be a silly question, but you said, as they're kind of looking at their payer mix and they see something that's concerning, they need to take action. What might that look like?
It can be community outreach. I think health centers in general do a really good job of getting people enrolled in Medicaid or the marketplace, but in any work, our teams can become a little bit complacent or maybe not be as active in that. So making sure that you're doing that. And so we've had health centers that have noticed their Medicaid population declining and took an active effort. And, it was through a combination of things, made an active effort to get more Medicaid patients in the door. So even though they might have lost some Medicaid patients, they had new ones. And so it really is paying attention to those things early on too, because you don't want to be at the end of the year discovering that your payer mix has completely shifted and having to make really difficult decisions about staffing as a result.
Now, workforce strain continues to be a major challenge. What workforce issues are most pressing, in your opinion and with your expertise, for Arizona's health centers right now?
So there's 3 areas where we consistently hear about challenges at health centers. And so they are medical providers, they are medical assistants, and then behavioral health providers. The audience is probably aware of this already, but we have a shortage of primary care providers, both nationally and in Arizona. And so what makes it even harder for Arizona is that there are not enough residency slots for all the medical students that train in Arizona. So what ends up happening is people leave Arizona for their residency, and they are more likely to stay in whatever place they go to practice after their residency. And so we would really love to retain providers in Arizona, and to do that, we need more residency slots. And more specifically, we need more residency slots in community health centers, because those then really help prepare primary care providers for the community health setting. When folks do train in a health center, they're more likely to stay in a health center. And so that's something that a number of health centers in Arizona are working on right now. We also don't have enough medical assistants. So this has been something, when I came into this role at the end of 2021, this was something I was hearing constantly. It is still very much true. The need for medical assistance continues to grow. And in order for providers to effectively see patients, they need to have MAs on staff. It's not something that can be done without MAs. And so we have been working with health centers on upskilling. So front desk staff that are really promising and want to stay with the health center, we now have an MA certification course that they can go through to take the test to become an MA. And then the health center will work with them on their clinical hours, and they have the opportunity then to stay at the health center. So that's something we're seeing that seems to work, a grow your own model. The market in general for MAs is very competitive. So if you're in the Phoenix area and, a large healthcare system can pay more for MAs than a health center can, and folks jump from place to place. So we're really looking at how we grow our own and continue to support people in our communities that want to advance in the health center. And then I would also say, in terms of behavioral health, we continue to see the need for behavioral health services growing. This is now the second largest service that health centers are providing in Arizona. It wasn't always, but there's a tremendous need for a variety of behavioral health positions too. And then for all these positions, I think the other piece is that there's a real risk of burnout because we are short-staffed, because the demand is so great, because we are in this environment where we're trying to do more with less. Each staff member can only handle so much. And so it's a real concern. I think the other thing too that we don't always talk about, but I want to mention, because we talk about clinician shortages a lot, the people that are providing direct services, but in rural areas, there are other challenges that exist. So when you talk about finance staff, HR, billing, IT support, sometimes even janitorial or landscaping, but in many of those areas, those roles are just harder to fill. You have to find and train people for the positions. And then the other opportunity is it possible to build shared services for some of those things so that there's economies of scale and folks can get the resources they need without necessarily having to find something that doesn't exist in their community.
Yeah, as you were talking about this, I was also thinking of the FQHCs that we're partnered with are predominantly in rural areas of the state. And so that's also a barrier, just finding talent, finding resources, let alone obtaining them.
For example, in a rural area of the state, an MA, okay, you could have somebody that you could train to be an MA. They might start out front desk, they might start at back office. Somehow you have that opportunity. But think about like a chief of human resources or a CFO, somebody that has to have this tremendous body of experience and also education. And that doesn't always exist in every rural community in Arizona or in the country. And so how do you solve for that too, when you really do need those functions to be able to operate your organization?
In the next part of this series, we'll continue our conversation with Jessica and take a closer look at the tools, innovations, and strategies health centers are using to adapt to a rapidly changing healthcare landscape. Thanks for listening to The Exam Room.